You guys all sit in the back? You need a little bit more time?
Just a couple seconds.
No, I'm in no rush, honestly.
Thank
No
you.
rush at all.
Start this back up. You see the video? Albany Med presser. Thank you. Here you go.
Good. All right. Good morning. I had hoped to meet with you today with good news. News that after 7 months, the New York State Nurses Association had decided to listen to our nurses and move forward. Instead, the union made another choice. It was not the choice of our nurses, who told us they wanted Albany Med's contract proposal to go forward for a vote. We have previously discussed what our proposal included. Let me remind you of some of it. Robust base hourly wage increases of up to over $11,000 per year. In addition to that, enhancements to special pay programs, including increased pay for being charge nurse, increased pay for precepting new nurses, and reinstatement of premium pay, which is a rate above overtime. Our proposal also has heightened recruitment and retention efforts and staffing goals that are aligned with the New York State Clinical Staffing Plan. Also, importantly, preserving the right for nurses to choose whether to pay union dues or not. A true open shop, a status they have today. It is in their contract now. Our nurses do not want that changed. Last time I was here, I told you that when we look at our nursing workforce in total, from new graduates to experienced nurses, our contract proposal would see increases to registered nurses for base salary by on average 13% in the first year and ranges from 25% to 34% over the course of the next 3 years. And that is just base salary. I think that this is very important, and I'd just like to spend another moment on this, because when one is talking to NYSNA or hearing some of their talking points, one of the things that I've heard represented is that our increase of base salary is only 3%, which is completely false. So let me go over it again. The math. The current starting rate for nurses at Albany Med is contractually $33 an hour. We want to change that. We need to change it for recruitment. Our current proposal would increase that from $33 an hour to $37.50 per hour immediately. Next year, that would increase to $38.50 per hour, and with merit increase, it would move up to $39.66. In 2026, that would increase to $40.66, and with merit, it would go up to $41.88. And now that nurse, in many cases a new graduate nurse who has been at Albany Med for 2 years, would be eligible to be a clinical nurse 3 and would make $44.39 per hour. And what is $44.39 at 2,080 hours per year? That is over $92,000 a year. That is an increase of $11.39 per hour from 2024 to 2026, which is 34.5% increase. And that is in our contract. And I can give you many other examples, but again, the ranges are from 25 to 34% over the course of the next 3 years. That is an increase they deserve. It is one I want to give them. But the union did not even have the courtesy to allow that proposal to come forward for a vote. Instead, the union responded to our proposal by putting a press statement out to the media. Hundreds of our nurses have emailed the union in the last week, and universally, what I heard from our nurses is that they have received no answer back from the union. No response. Silence. Absolute silence. Albany Med has always represented our nurses first. We have always listened to our nurses, and we always will. And I will tell you, I listened to them last night, and they are very upset with the union that is meant to represent them here at Albany Med. They are very disappointed that the union refused to even bring our proposal forward for a vote. The union's sole interest is money in their pocket, collecting dues from members and requiring all Albany Med nurses to auto-enroll and become dues-paying members whether they agree to it or not. I don't think that's appropriate, and I won't agree to anything I don't believe benefits our nurses. Yet there are a lot of distractions to cover up that position. NYSNA has said that Albany Med is not safely staffed. That is false. NYSNA says there is not enough nurses to care for babies in our neonatal intensive care unit, which is the only one in our region. That is absolutely false. NYSNA says our contract does not protect patient care. That is absolutely false. The union's claims are a slap in the face of close to 3 million people in this region that are served by Albany Med. And I would say a slap in the face to the nurses who have held newborn babies in their hands, who have held the hands of family members in their most challenging moments, and have held the hands of patients on days they might never thought they'd see. Our nurses work here. They live in this community. They know what our community needs best, not some third party which appears to be infatuated with manipulation and fear tactics. As you know, Albany Med is in the news a lot. It always has been. Often very positive. Front page stories above the fold. Lead story on the news. A life saved. A new therapeutic breakthrough. First in the region to offer some groundbreaking treatment. Other times, maybe not as positive. For example, for a time, our emergency department was under a microscope and received unflattering media stories. Proudly, today, I can stand here and tell you our wait times are down dramatically by 5 or 6 hours in our emergency department. Patient satisfaction is going up significantly. I'm proud to tell you that story because I'm proud of our nurses and the entire care team that makes our emergency department and this hospital the busiest trauma program in New York State with objectively measured the best trauma outcomes in New York State. For a time, staffing was under a microscope, yet this year we've kept and hired more nurses than the union cares to talk about. Over 250 hires this year alone. We have strengthened existing programs and established new programs with every nursing school in the region. And our hospital is safely staffed. It always has been. For a time, the union used the Department of Health as a tactic, weaponizing a very good relationship between hospital and regulatory agency. The DOH visits hospitals routinely. Nothing to see there, no big story. And proudly, I can tell you the last time the Department of Health was here on campus, just a few weeks ago, looking at our emergency department, they left full of praise. They left full of praise and had no findings, no deficiencies. Trust is earned, and it is earned by objective, researchable facts. So where do we go from here? Our nurses remain, unfortunately, stuck in the middle. And it's up to the union now to break that logjam. Our nurses want to move forward. Our entire staff, more than 10,000, want to move forward. We are confident that the work we do and the services we provide to this community is second to none. It is indispensable. So my ask is this: allow us to do it without distraction. NYSNA needs to listen to our nurses. Our nurses want this deal. They want to move forward. They want to do what they do better than anyone else. They provide the most advanced patient care in upstate New York, and they want to do it without distraction. Our excellent proposal is still sitting on the table. I call on elected officials, local and statewide, who, like us, know the role Albany Med plays in this region. They need Albany Med to be able to recruit and retain nurses. I ask them to speak up. Please lend their voices and tell NYSNA this deal is a good one and they need to take it for a vote. NYSNA needs to change their strategy and take the deal. The nurses I represent are ready, and it is time to move forward. And with that, I'm happy to answer any questions.
Does this one come with a deadline now? Another deadline?
What you are referring to is last week when we brought this forward, we called it our last best final offer. In addition to that, we put an opportunity for retro pay on the table as a time-limited addition to the contract. You remember at the time I mentioned the reason it had to be time-limited is we are in December. We are putting together our budget package and proposal for approval for the board. Unfortunately, the deadline of 5 p.m. is passed. The retro pay is off the table, but all the other excellent things that were in our proposal and our contract remain. I will say specifically on the issue of the retro pay, I think that is something that many of our nurses are very frustrated and upset with NYSNA for in particular. Again, NYSNA did not even have the courtesy of speaking to our nurses. They certainly never even reached back to us. We excellent proposal on the table. They put out a press release. And so the retro pay is off the table, but the remainder of the contract, which is still an outstanding proposal, that base adjustment I referred to, that still remains in there. The preceptor pay, the charge pay, the premium pay, the optionality of dues, the excellent staffing levels, all of that is in our current proposal.
And when are you hoping that they will give you an answer?
I would take a call from them at the top of this hour. I mean, honestly, they can listen to me, but I think it's more important they listen to the nurses. If you were to walk around this hospital like this entire leadership team has done in the front of this room, you would hear the same thing I hear, which is that I would estimate well over 3/4, 80% of the nurses that I walk by stop me and say, I'm so disappointed they did not bring this forward for a vote. Dennis, we'd love this contract. Let's get this done. So they can listen, NYSNA can listen to me, but really my ask is they need to listen to the nurses that they represent here at Albany Med. And so we would take that call from them at any time.
What percentage of nurses are union versus non-union?
That's a great question, and you'll have to ask NYSNA because they won't tell us. One of the things that's very interesting about Albany Med is we are an open shop. As you know, Dave, when you have a shop sometimes that is closed, those union dues are automatically withdrawn from their pay. They'll see it right on their pay stub. They'll see it right there. That's not the way it works here because enrollment in the union is voluntary. The way in which the union collects dues here is on credit cards of our nurses. And when we've asked them how many have joined, they've not told us. My suspicion often is that number is actually quite low. I think if it was a large number, they'd be proud to say it, and they would be more than happy to tell it to us. So we don't know that answer, and perhaps that's something that you could ask them. I do know, because when I walk these halls, that many of the nurses who were in the union and paid dues within the last few years have actually decided to pull out of the union because their frustration with what they appear to see as not advocacy for them, including this excellent proposal.
NYSNA continues to kind of mention the staffing crisis and ask for additional staffing. What in your proposal directly responds to that?
So I think you heard it. That's why I took the time to very specifically go through that. If you know that today we have a contract with NYSNA where the starting salary is $33 an hour, and our proposal would immediately move that to $37.50, and over the course of the next 3 years would increase our starting salary by 34%. I think everybody would immediately recognize that is a recruitment strategy, right? That is absolutely. And by the way, there's a retention component as well, because while we're moving the starting salaries, we're also moving everyone else who's in the nursing organization. Some, their base salary would move by $5.50 per hour. Base. That does not include differentials for working nights or weekends. That does not include charge pay. That does not include preceptor pay. That does not include premium pay. So it's easy. It's a soundbite for NYSNA to say staffing. And I say the way we work on this together is recruit more nurses and hold on to them. Mm-hmm. And even without the acceptance of this contract, I can tell you the numbers suggest that we have hired 250 nurses or more this year. Our turnover is going down. Our retention is going up. We've had over 100 nurses who left Albany Med for a while, who came back. So I'm very happy where we're at right now. But I'm 100% sure that if we can get this deal done, we could recruit 350 or 400 nurses next year. We have programs with Maria College. We have programs with Hudson Valley. We have programs with Sage. We're starting one with University at Albany. Their nursing students do clinical rotations here. They do capstones here. I could spend an hour at this podium talking about all the efforts we have on recruitment and retention. What I'll tell you is this absolutely is something that would go a long ways towards helping that as well.
Yeah, I understand the wage incentive. Do you plan on hiring more nurses in this next year? Is that like a goal?
Absolutely. I've given our chief nursing officer, who's sitting right here in this front row, a goal of going out and hiring more nurses next year than we've hired this year. What we'd like to do is we'd like to hire, I'm a big believer in people in the community, local people taking care of their community. That's why I'm so proud we have relationships with all the local nursing schools. And of course, we reach beyond the region as well. Kevin Zhang, who's our chief nursing officer and leads a fabulous team here, has a goal of next year of going out and hiring well in excess of 300 nurses. And honestly, as you know today, because we're the area's only children's hospital, we're the area's only trauma program, we're the area's only academic medical center, we have to keep this hospital fully staffed. And the way we're doing it right now is we're supplementing our full-time staff with travel nurses. Our goal, unambiguously, is to drive that number of contract labor down, that travel nurse down, and drive up full-time staff. And I think we're making progress there. This absolutely would make a huge difference there. Absolutely.
Yeah, when you mentioned the 250 hires, do you know how many of those are travel nurses?
No, those 250 that we hired, that's full-time staff.
Okay,
Yeah, we hired over 250 this year, full-time staff.
okay, thank you.
You're welcome.
You mentioned the ER wait times are down by 5 to 6 hours. So what is the average wait right now at the ER?
When you, we can get those numbers for you offline. So there's two different metrics that we look at. We look at from arrival in the emergency department to when a disposition is made, meaning they need to be admitted or discharged. Some of those people go home. Some of those people get admitted to a bed upstairs. What I can tell you is that metric of arrival to discharge or arrival to admission has gone down by about 5 or 6 hours. We can get you the numbers, and I'm happy to share them because we look at it a couple different ways, and I don't want to give you some false information as far as what our time now is from arrival to discharge. But I can tell you it's come down by 5 or 6 hours. We measure the acuity of the emergency department using 5 different tiers, tier 1 through tier 5. And our goal, of course, is to open up each day and have as few people in the waiting room and a minimum number of people in the emergency department who are waiting for beds upstairs. This morning, for example, if you came in like we all did at 7 a.m., the number of people in our waiting room was 0. 0. With the same volume that we've had over the last several months. We're seeing significant improvements in efficiency. We're seeing a significant improvement in throughput. And that is a complex issue that we've talked about in the past. It has to do with how the ED operates. It also has to deal with how the hospital operates upstairs and making sure that people are ready to be discharged, are able to move out of the hospital to the next level of care so a bed's available. So upstairs and downstairs are operating significantly better. We're seeing our length of stay go down. We're seeing our ED wait times go down. We're seeing our ED orders go down. We're seeing our left without being seen go down. We're seeing our waiting room numbers go down. And there's still work to be done, by the way. But I'm proud to say that that work is happening, and it's really a significant improvement. And by the way, people have noticed it. I received many letters from people who say, I was in your emergency department a year ago. I was in just last month. It's fantastic improvement. We appreciate that. And I credit that by a fact that we've been able to staff the emergency department better. We've been able to reduce the turnover there, and our nurses and doctors are working on this together. And this will go a long ways towards allowing us to sustain that.
And that 0 number is for the ER? Okay.
When you say those are our numbers, the numbers I just said?
Yeah.
Yeah, the 5, yes, that's Albany Med's ER, yes.
Okay. The only other thing that I'm confused about is the union dues and being a closed shop or an open shop. So you guys say you want to keep it an open shop for your nurses, that they have the option to choose if they want to pay dues to the union. Well, we asked the union that last week right after the presser, do you want it to be a closed shop? And they said at first that's what they wanted, but they took that off the table and they're fine with being an open shop. So what's the deal there?
I'm so happy you asked that question. That's not true by the union. Let me tell you exactly what their proposal is. You're correct. At one point, their position was very firm. They wanted a closed shop. Their current proposal, they recognize there's no appetite here at Albany Med by the nurses to be a closed shop. By the way, an open shop is a status that many public service employees at the state and federal level enjoy, right? Membership in union is something that at the state and federal level for public service is optional as well. So the current position from NYSNA, as written in the piece of paper that they gave to us, is this. Effective immediately, if their language was adopted, which would be a change from our current contract, if their language was adopted, every nurse who's currently here at Albany Med and every future nurse would automatically be enrolled in the union, number one. They would automatically have to pay union dues. That would continue for 6 months. There would be a 30-day window by which, if they chose to, they could opt out of the union, and that process is not straightforward. I would certified letter or some sort of very specific communication with them. If they missed that window, they would remain in the union and pay dues for the entire time they're here at Albany Med. And one more thing, the language they gave us would say that if a nurse was in that situation and they were in the union beyond that 6-month window, and maybe they had a change of mind and they didn't want to do it anymore, and they wanted to stop paying dues, the union's position is that we, Albany Med, would have to terminate that person. That's their position, and it's in writing. Ours is very straightforward. It's optional whether you're in the union or not. You decide to pay dues, yes or no. It's very different position. Their position is absolutely not an open shop, and I'm so glad you asked that question so I could clarify that.
Can you share what they put to you in writing?
We absolutely can. We have information we can share about that. Any other questions?
Any update on negotiations with CDPHP?
We continue to meet with them. I can tell you that there's been dialogue by myself and Brian O'Grady as recently as this weekend. We've obviously exchanged some documents. Certainly, it is my hope that we can reconcile the two outstanding issues. The first one, I'll remind you, is the fact that in 2024, CDPHP has withheld from Albany Med payments that are now approaching $40 million. They've recognized that. They've said that out loud. They understand that they need to pay that back to Albany Med. The other outstanding issue, of course, is the contract proposals for 25 and 26, and our minimal expectation that a contract needs to at least cover the cost of care. Where we go from here with them, obviously, we're exchanging documents, and I believe, today, if not by today, tomorrow, we're expecting a document back from them. And the next step is an in-person meeting that includes the senior leadership from our team and their team. We're approaching the end of this month. If we get to January 1st and we don't have a contract, what the public needs to know is we're in a 2-month cooling off period, and for all intents and purposes, things do not change. And that's done as a way primarily to give those sides a chance to still get the deal done. My hope, of course, is that we'll get to a point where we won't need to get into that cooling off period. But if we do, we'll, of course, continue to meet with them with the hope of getting it done. So that's where we're at.
A NICU nurse reached out to me and told me that there were 6 triple assignments this morning for the NICU. In your opinion, is there a staffing crisis at Albany Med?
There is not. I walked through the NICU last night. I walked through the NICU a lot. When I walk through the NICU, what I see in every single case was no chaos. I saw babies either sleeping, being held by their parents, in some cases nurses in the room attending to them. I saw several nurses sitting around the desk doing their documentation at the end of the shift. I saw some new nurses coming in. I asked every one of them, how are you doing? How are things? They said, we're fine. Things are good. I think it's important to understand, because the NICU does come up a lot, right? Let's talk about the NICU. We are a level 4 neonatal intensive care unit. We're the only one in the area. We take care of, obviously, the most premature babies here. We have capacity in the NICU to take care of up to 60 babies, although from a bassinet standpoint, we may have 56. There are days where we'll walk in like we did last night, where we'll have 47. Some days we'll have 40 babies. Some days we'll even have less than that. What sometimes we'll hear is that the number of nurses who are working on a particular day is less than what's in the clinical staffing plan. And while that may be true, there's often more to the story than just that simple number. What sometimes happens is when we start the day, the number of babies that are in the NICU is less than we would have budgeted or less than that we would have expected. And so what we'll do on some of those days is we'll say to some nurses, you have the optionality if you want to go home today, right? So when we have less than what we're budgeted, it's because we have less babies than we're expecting to have that day. We have a float pool. If the numbers go up, like for example, we may have a mother who delivers triplets unexpectedly. We may have a baby that's transferred in from another hospital. If our numbers go up, then we supplement that with staff. We have all sorts of ways in which we can do that through a pediatric float pool, and we have other resources available as well. So to answer your question very specifically, do I think that we have a staffing problem in the neonatal intensive care unit? The answer is absolutely not. Absolutely not. That's my lived experience. And by the way, I received several emails within the last 24 hours from nurses in the neonatal intensive care unit who say, by the way, this contract that I talked about, they would love it, and they'd love us to get it done. Any other questions from the podium? If not, I'm happy to take any down here. Okay, the thank yous. And I guess I'll just conclude with where I began, which is my sincere hope that we can get this done. At the end of the day, this is not about me. This is not about Dennis McKenna. This is not about anybody getting credit. This is not about any one side claiming victory. What this is about us and our ability to take care of our nurses. And the numbers I just gave you are in our contract. It's a contract that overwhelmingly our nurses want. And I really hope that they speak up. I hope that NYSNA listens, and I hope that we can get this done. So thank you.
Thank you.
Thank you.